Hi there, it's Dr. Hart again, and this is Nursing with Hart, PhD, on my YouTube channel. These are the last 5 questions that I picked out on the topic of schizophrenia after the lecture that I posted yesterday. These will follow that lecture. So let's get started. Number 1, first, the nurse is providing discharge teaching to an elderly client diagnosed with schizophrenia. The client's medications include antipsychotic risperidone and a beta-adrenergic blocking agent, propranolol. Which statement indicates the nurse understands the combined side effects of these medications? I have not covered psychopharmacology yet. I will be doing that very soon. Look out for that. That will be just the medications for the mental health disorders that are most common. But I did cover this part, I believe, in the content on schizophrenia that I posted yesterday. Okay, so let's look over the answer choices. Number 1, concentrate on taking slow, deep, cleansing breaths. Number 2, limit your intake of foods that are high in sugar. Number 3, move slowly when you change from lying down or sitting position. And number 4, always wear sunscreen and a hat when you are exposed to the sun. Okay, so here you have to know the antipsychotic risperidone and the beta-adrenergic blocking agent propranolol. Okay, so you have to know those 2 medications in order to answer this question, and you have to know what are the possible side effects of these. Okay, so I'll give you a minute to take a look at these answer choices to figure out which one you think it is. Let me take a minute to encourage you to like, subscribe, and share my YouTube channel, Nursing with Hart PhD. I'm also on TikTok, Susan Hart 63, and recently on Instagram I'm sharing my videos, and I'll put those links in the description for my videos in my bio. Okay, so let's go back to this question. So here you have to know these 2 medications. One's an antipsychotic, risperidone. That is brand name. One of the brand names is Risperdal. So you know risperidone is the generic name because it has a small letter R. Medications are only going to have one generic name, but they can have multiple brand names. So the brand name for risperidone is Risperdal. One of the brand names is Risperidone, and a beta-adrenergic blocking agent, propranolol. So the correct answer on this one is number 3. Move slowly when you change from a lying down or sitting position. Okay, the combination of antipsychotic medications. Okay, so the antipsychotic, and what's the other one? Propranolol, ending in OL. OL is your clue. That is a beta blocker. Those are both placing your client at risk for injury because they can cause orthostatic hypotension. Okay, so let's look at the other answer choices. Concentrating on taking slow, deep, cleansing breaths. Okay, this is not correct. This is not side effects of these medications. Same with number 2, limit your intake of foods that are high in sugar. That's not a indication or a side effect of these medications. And always wear sunscreen and a hat. Okay. Okay, so the clients taking antipsychotic medications should avoid sun exposure, but not with the beta blockers, okay? All right, so you have to look at both medications, and the answer has to be true for both of the medications. All right, next one. The nurse is obtaining the mental health history of a client diagnosed with schizophrenia. The client's family reports that the client is hearing voices and cannot stay focused on the topic of a discussion. The nurse recognizes the client is demonstrating which symptom? Is it 1, delusions of reference, 2, tangentiality, 3, neologism, or 4, loose associations? Okay, we'll give you a minute and we'll come back. Okay, we're back. The correct answer on this one is tangentiality. Okay, this is where the client is veering away from the topic of discussion and has difficulty maintaining focus and attention. Okay, let's look at the other answer choices. Number 1, delusions of reference. Delusions of reference are fixed false beliefs and adhered to despite evidence to the contrary. Okay, number 3 is neologism. This is not a neologism. Neologisms are newly invented words. The client has invented the word. They have a symbolic meaning to the client, but they are meaningless words to other people, like the Shapatulians question that I showed on part 1 of the series, 2-part series of questions. Shapatulians is a neologism. And number 4, loose associations. Okay, loose associations are speech where the idea shifts from one unrelated subject to the other. Okay, and the patient with loose associations is not aware that the topics are unconnected. Okay, let's look at the next one. The nurse assesses the client who exhibits a flat affect, paranoia, anhedonia, inertia, neologisms, and echolalia. Which statement indicates the nurse understands the characteristics of positive and negative symptoms of schizophrenia? So here you have to know the difference between positive and negative symptoms of schizophrenia. Number 1, paranoia, anhedonia, and inertia are positive symptoms. Number 2, paranoia, neologisms, and echolalia are positive symptoms. 3, paranoia, inertia, and echolalia are negative symptoms. Or 4, paranoia, flat affect, and anhedonia are negative symptoms. Okay, and I'll give you a minute to think about it. Okay, and we're back. So let's talk about it again briefly about the difference between negative and positive symptoms of schizophrenia. So the positive symptoms these are symptoms that are present or added in people with schizophrenia and not typically present in people without the disease. Added to, positive. Negative symptoms are referred to as defects or impairments, things that are taken away by the illness in individuals with schizophrenia. So positive on one end are added symptoms, added to the typical presentation for people. Negative symptoms are deficits or impairments that take away from the person. Okay, so the correct answer on this one is number 2. Paranoia, neologisms, and echolalia are positive symptoms. Okay, let's look at the other answer choices. Number 1, paranoia, anhedonia, and inertia are positive symptoms. That is incorrect. Okay, paranoia, the positive symptoms in number 1 are paranoia. Paranoia is the only one. Positive symptoms are present in a person with schizophrenia. It would not be present in a person without the illness. Negative symptoms are those that reflect a decrease in normal functions that have been taken away by the illness. So number 1, anhedonia and inertia are negative symptoms. And the clue there is both of those words. Now, this is not true for all negative symptoms, but the clue here is the words anhedonia and inertia. Okay, anhedonia is a lack of motivation. Inertia is a lack of energy. So those two words both begin with the letter A or an. Okay, and words with the prefix a or an mean without, like anorexia. Okay, so that's how you're going to remember some of those, not all of them, but some of the negative symptoms of schizophrenia. Okay, so in number 3, paranoia is positive, inertia is negative, echolalia is positive. Okay, so those aren't all negative. Paranoia and echolalia are positive symptoms. Inertia is the only negative symptom in number 3. Number 4, paranoia is positive, flat affect is negative. Okay, and anhedonia is negative. Okay, so the paranoia positive. Okay, so the only negative symptoms in number 4 are flat affect and anhedonia. All right, one more question. The nurse is administering medications to a client experiencing acute psychosis. The client's medication orders include haloperidol 50 milligrams PO BID, benztropine 1 milligram PO daily, and zolpidem 10 milligram PO at bedtime daily. The nurse administers benztropine to address which of the following? Number 1, tactile hallucinations. 2, involuntary facial movements. Or 3, psychomotor retardation. Or 4, pacing back and forth. And I'll give you a minute to think about it. Okay, and we're back. All right, on this one, the patient is taking haloperidol. The haloperidol, brand name Haldol. Okay, haloperidol is the generic name. The brand, one of the brand names is Haldol. Okay, this is a very common antipsychotic. This is a first-line, first-generation, typical medication. It's very strong, and it can have some serious side effects, and I talked about those in my lecture, so go back and check those out. The other medication that the client is taking is benztropine. Benztropine, okay, is an anticholinergic, and zolpidem is a sedative. Zolpidem is brand name Ambien, used for sleep. So why is the nurse administering benztropine to address which of the following? All right, correct answer number 2, involuntary facial movements. Okay, so examples of involuntary facial movements are like lip smacking, funny lip and mouth movements of the tongue, face. Okay, benztropine is an anticholinergic medication used for symptoms of tardive dyskinesias, okay, characterized by abnormal involuntary movements. Tardive dyskinesia is a potentially irreversible adverse effect of antipsychotic medications. In other words, irreversible means that it may these serious side effects may continue even after the medication is stopped. Even after the patient stops taking the medication, these serious side effects can continue. So the benztropine is the anticholinergic that will counteract those serious side effects, or EPS, I talked about in the lecture, extrapyramidal symptoms. And tardive dyskinesia is one of them. And those are the involuntary facial movements. Okay, let's look at the other answer choices. We're not treating tactile hallucinations with the benztropine. We're not treating psychomotor retardation, and you're not treating pacing back and forth. Okay, and so that's it for this one, and I will, like I promised, I will in the next couple of days cover the content on psychopharmacology, and then I will share some test questions on the antipsychotic medications. Okay, we'll see you soon again. All right, have a great day.